Greetings and welcome to the Fatherhood Research and Practice Network, a learning community webinar on using cell phone technologies in fatherhood programs and research. I'm Jessica Pearson. I direct the Center for Policy Research in Denver, Colorado, and I'm co-director of the Fatherhood Practice Research and Practice Network. Want to take a few minutes to tell you a little bit about FRPN. Then I will tell you a little bit about today's webinar, and then I'm going to introduce our wonderful panel to you, and then we'll launch into business. FRPN is co-directed with me by Jay Fagan and Rebecca Kaufman at Temple University. My colleague Nancy and I at the Center for Policy Research work on FRPN. It is a 5-year cooperative agreement between the Office of Planning, Research, and Evaluation at the United States Department of Health and Human Services to Temple and CPR. We are beginning our 4th year of 5 years, and the essential overarching goal is to build the evidence base in the fatherhood field by sponsoring and promoting quality fatherhood research, communicating that research with practitioners, and promoting the use of research in the conduct of fatherhood programs. The network has 3 primary goals, and I'll tell you a little briefly about each one. One is to promote rigorous evaluation, and to date we've funded 9 researcher practitioner teams to conduct randomized controlled trials and other rigorous studies of fatherhood programs. We're currently in the process of reviewing letters of interest and proposals for another round of awards that will make for descriptive exploratory studies. We've developed and validated new outcome measures for fatherhood research dealing with parenting and co-parenting, and we are conducting research on co-parenting and maternal engagement, trying to address gaps in the fatherhood field. We also work on building evaluation capacity, and to that end, we hold webinars like the one you're listening to today. We conduct training programs at fatherhood conferences in New England, Ohio, NPCL, FFCA, and other conferences. We prepare research and evaluation briefs on a variety of topics. We have technical assistance calls with our own grantees and with selected grantees in the Healthy Marriage and Responsible Fatherhood program funded by OFA. And we work with individual researchers and practitioners. Our third goal is to communicate and disseminate information, and the main vehicle for that is our website, www.frpn.org, and there you can see and find all of our outcome measures, listserv to connect researchers and practitioners to one another, print and web resources that we've developed, and also sign up for our monthly electronic newsletter, The Blueprint, which we have about 1,500 subscribers so far, and it's really your best way of staying involved with our activities. So why are we doing a webinar on cell phone technologies and how they can be used to engage, service, and collect information from hard-to-reach populations like fathers in fatherhood programs? Well, the main reason is because they're ubiquitous. And I don't know newer stats, but 91% of the population had a personal cell phone, and half of those had smartphones in 2013. It's been smartphones are used to collect data and health behaviors and track program participants in the health field to great effect. Few studies have tested the impact of cell phone technologies on engagement and retention, and there's been really no published research on engagement and retention with fatherhood program participants, although as you will hear today, both Ken and Anna are helping to remedy this situation, and they are two of our panelists. Our panel starts off with Lindsey Zemer, who is a evaluation associate with the Food Supplement Nutrition and Education Program at the University of Maryland Extension, and she'll be talking about text message-based intervention program intended for low-income parents of elementary school students to address obesity. Next, Naomi Sugie, who is assistant professor at the Department of Criminology, Law, and Society at the University of California, Irvine, will describe a program that involved using cell phones with smartphones with men on parole in Newark, who deals with their reentry experiences, and an online job club and peer-based text messaging. Ken Harris is third up. He's the director of the New Haven Healthy Start and president of the National Healthy Start Association, and he will talk about their experiences engaging fathers in Healthy Start in New Haven, including the results of focus groups with fathers about how to best integrate the use of cell phones in programming. And last, Anna Hayward, associate professor at Stony Brook University School of Social Welfare, will talk about a new program she's doing using cell phone technologies to engage and retain men in responsible fathering services. This is a project that FRPN is funding. Lindsey, would you start us off?
Sure. Thank you, Jessica. Hi, everyone. I'm Lindsey Zemer. I'm the Evaluation and Mobile Technology Associate for Maryland SNAP-Ed program. We develop nutrition education programs for low-income families or low-income audiences who are eligible for SNAP programming. And today I'll be talking about providing an overview, some evaluation outcomes, and lessons learned from one of the text message programs that we've developed to engage low-income parents in school nutrition. So the target audience for our program is, again, low-income SNAP-eligible families in Maryland. Previous research has shown that texting is actually a good way to reach parents or to reach these audiences, as lower-income audiences do use cell phones and text message services. Recent research shows that 84% of this audience owns a cell phone, and 13% of this audience are smartphone dependent. And text messaging has been found to be the most widely used smartphone feature among users. So this is a really good platform for trying to reach this hard-to-reach audience. Our interventions with the Food Supplement Nutrition Education Program tried to reach target audiences through multi-level interventions. So this is reaching individuals, families, or home and school environments, sectors of influence, and social cultural norms and values. So we do this through providing direct education to individuals, providing parents with newsletters, conducting grocery store tours with parents, and in this program we provide parents with educational text messages. Text to Be Healthy is a program that is actually in its 6th year this year, and it's a way to reach parents of elementary school children who are receiving nutrition education in school. So parents who sign up for this program typically receive about 2 community-specific text messages per week, and the purpose is to promote nutrition and physical activity, connect the parents to the school and community nutrition resources and events, and to just reinforce key messages taught in the classroom-based nutrition education within the home to try to change the home environment and provide a healthier eating environment. So a couple of the program objectives are to increase fruit and vegetable consumption in both children and parents, to increase the variety of fruits and vegetables consumed, and to increase daily and weekly physical activity. So elementary schools are location specific and are really a great way to target all parents in the same location. And just by knowing the location, we're able to gain a lot of information about location specific retail such as grocery stores. We can text about grocery store sales, recreation, different parks or community events that are within that area, libraries. We know about the weather. We can gain information about school schedules, testing, and different events that are happening in the school. We know about lunch menus and local events going on in the community. So we can really make this very specific and school-based, target-based without even knowing the parent's name. So let me talk a little bit about program recruitment now. We've developed a number of recruitment methods throughout the years. We use flyers, which have a keyword to text into a short code, which is 30644, and we distribute these to parents within the school so that they can self-enroll. We also post posters throughout the school or in other community areas. We have in-person events, so someone from our office or one of our local community offices will often go to the schools and try to recruit parents at back-to-school nights or other school events. And we've really found that in-person is one of the best ways to reach parents as we have that direct communication and with them. We also have a website that they can use to enroll and other school channels such as newsletters, robocalls, or promotion at parent nights. And recently we've developed an iPad app that we use. You can see that's the blue one on the right side that we use to enroll parents, and it sends them a message directly saying that they've enrolled in the program. So again, we found that in-person enrollment does work best and attempts to overcome some of the enrollment barriers that we've found. So about 26% of non-participants reported that they just didn't know how to enroll in the program, or they had tried but were not successful in enrolling. Some parents are concerned about the cost of texting, and the text messages are free with an unlimited texting program, but some parents may have to pay per text. And, another barrier is some people are apprehensive about program content. We've tried to provide information about that and to also ensure them that they'll only be receiving 1 to 2 text messages per week. Some people have reported disabled short codes, and some parents are not aware of how to send a message to someone not in the address book. So if they have to text into a short code instead of someone in their address book, that might be difficult for them. And then enrollment of non-targeted individuals. And it's important to consider dropouts in developing the program as well. All right, so I will switch gears and talk a little bit about our evaluation strategy. For the Text to Be Healthy evaluation, we've done a school-wide pre- and post survey, and this is either a mailed print version of the survey or a survey that's available online. We do pre-tests in September and post-tests in May. And we've been using a survey called the Healthy Family Survey, which we adapted from a survey that was developed from UC Davis Townsend Lab. And this assesses eating behaviors, physical activity behaviors, food availability and accessibility, especially within the home, and role modeling, so parental role modeling of fruit and vegetable consumption or a physical activity. We've also done texted questions, so we use the texting platform to send quick evaluation messages to gain real-time data. We've done focus groups, especially in the earlier stages, to develop program content and gather some information about the types of messages that people would like to hear or to receive, and the time of day to best send the messages, all of that formative information. And we've done evaluation in both intervention schools, those schools that are receiving Text to Be Healthy, as well as control schools that are not receiving Text to Be Healthy, so that we can determine impacts of the program. A couple of the outcomes that we've discovered from the program, almost all of the Text to Be Healthy participants report regularly engaging in the health behaviors suggested in the text messages. So they report doing something suggested in these texts at least some of the time. We've also found that 69% of participants felt that the information in the text applied to their lives most or all of the time. And a lot of this has to do with the location-specific targeted messages. A couple other outcomes related to our key objectives are there was a 13% increase in the number of children who reported eating fruit every day, as well as eating vegetables every day. And in terms of snacking behaviors, we wanted to assess fruit and vegetable snacking behaviors versus snacking on candy, chips, or cookies. We found that 33% of children eat fruits and vegetables as snacks more often, and 31% of children eat snack foods less often. In terms of physical activity and sedentary behavior, we found that 42% of children engaged in more physical activity during the week, and 39% of children engaged in more physical activity during the weekend. And after participating in Text to Be Healthy, an average of 9 out of kids reported exceeding the daily recommended amount of physical activity, which is 60 minutes or more per day, as recommended by the CDC. Additionally, in terms of sedentary behavior, the American Academy of Pediatrics recommends that children limit screen time to 1 to 2 hours daily. And we found that 35% of the children whose parents were participating in Text to Be Healthy decreased the number of hours of TV watched per day. And about 9 out of 10 parents were reporting that their kids watched 2 hours or less of TV per day. Now, as I mentioned, we also send out evaluation text messages to try to gain some real-time behavior outcome data related to program message content. These outcomes are related to fruit and vegetable consumption, physical activity, and role modeling behaviors. And this past year, we started implementing a reminder text to send before the evaluation text message. So this is just a short text that says, we're checking in again. We'll be sending you a question in about 10 minutes, and we want to hear from you. And then we would send the evaluation question about 10 minutes after that. So an example here is, last week we texted about sharing family meals, even during the holiday season. Did you sit down and eat a meal with your child this past week? And so we prompt the participants to reply with either yes or no. And sometimes we add in follow-up questions based on their response to the first evaluation question. So here we are asking them how many days their family ate a meal together, and we prompt them with a couple multiple choice responses. So we found that sending the reminder text has really increased our response rates. Without the reminder text beforehand, we only had about a 33% response rate to these texted questions. However, after adding in the 10-minute reminder, we were able to increase that to a 48% response rate. And here you can see a little graph to show our different strategies for increasing texted question response rates across the years. So this is from the first 4 years of the program. And in the first 2 years, we did not incentivize these text message questions, and we did not send out that 10-minute reminder. So you can see we really struggled with getting good response rates from those questions. However, in year 4, So you can see we actually incentivized the evaluation strategy. So both the pre and post survey were incentivized, and parents could earn money for responding to each of the text message questions that we sent. So the combination of the incentives and the 10-minute reminder really, you can see, did increase the response rate here. And we typically send about 10 evaluation text messages per year, so about 1 to 2 per month. Okay, so I just want to go over some lessons learned and recommendations for implementation of a text message program. So it's really important to seek substantial buy-in from partners, and this can really help to reach your audience, to promote the program and incentivize enrollment, and to connect the program to other activities. So you really want to have a good relationship with your partners and collaborators as they can really help to increase your enrollment and really be able to connect you to your target audience. As I mentioned before, in-person enrollment is critical. Again, we found that in-person enrollment is the best method to engage parents and to enable them to enroll in the program. So what we do is we offer to collect mobile phone numbers, and we manage the enrollment for parents. We also have some alternatives, but we found that this does work best. And lastly, it's really important to test materials and messages via focus groups. And as I mentioned, we did this in the beginning stages of our program development. Research shows that there's widespread use of cell phones and smartphones in particular, and most parents do use text messaging. So this is a really great way to reach that audience. And testing materials via focus groups, you can get some suggestions for appropriate messages, for the way to send messages. So we found that parents don't like when we send textisms. They like more formal language, I guess. They also like it to be personalized. So often we will send some messages that have their first name in the text to make it more specific. And you can also get some information about preferences for timing of messages. So we found that it's best if we send messages at 5 p.m. because that's when parents are just getting off of work and they probably have a couple minutes to check their phone, see the message, and then be able to implement something that was suggested in the message, like on their way home if they need to stop at the grocery store to pick something up, or if they, are able to take a walk with their family after dinner. So it's the best time for them to implement these suggestions. All right, so that's it from me, and I'll pass it back to Jessica.
Thank you. Thanks very much, Lindsey. Next, Naomi Sugie will be talking about cell phone technologies with ex-offenders through the New York Smartphone Reentry Project. Naomi?
Great. Thanks for inviting me here today. So the Newark Smartphone Reentry Project distributed smartphones to men who were recently released from prison and then followed their reentry experiences for 3 months. And so first I'll briefly discuss the motivation for doing this project, a little bit about the project design and some findings, and then conclude with lessons learned and a description of some challenges. And for this talk, I'll focus on one particular aspect of the project, which was random assignment to a peer-based group text messaging forum, which we call an online job club. And this was formed in order to support people's job search at Reentry. So the main motivation for the Newark Smartphone Reentry Project was to learn about how people look for employment and the types of work that they find at Reentry. So documenting these experiences during Reentry is really difficult for researchers because Reentry is a very unstable time period, and most people have more pressing issues than participating in a research study. So when I was thinking about this project, I thought that smartphones might help us improve initial participation rates and then help retain people at higher rates over time, because people could conveniently fill out surveys on their phones instead of having to come into an office to do an interview with a researcher. I also thought that I could recruit more people using smartphones since data collection, like surveys, are automated. And there were also potential advantages of using smartphones to study job searching and employment specifically. So for example, we know from qualitative research that people often find informal, day-to-day, irregular work at reentry. And these sorts of employment experiences are really difficult to retrospectively recall in interviews. Smartphones could ask about these experiences daily, so near real time, which enables us to systematically collect this information. Smartphones could also collect information about people's social networks and geographic locations. And both of these are considered to be really importantly related to how people are able to find work, but they're difficult, if not impossible, for participants to remember or to estimate accurately. And then finally, I thought that smartphones might be a good way to try an intervention, in this case our online job club, to assist people with their job search. And I'll talk a little bit more about that in a bit. So all of these advantages sounded really great in theory, but it was unclear whether these would actually translate into practice among men reentering from prison. So I had lots of questions about whether a smartphone study would work with this population. To help address some of these questions, I first conducted focus groups and interviews with clients of employment reentry organizations. And in these groups, people were really excited about the idea of a smartphone-based study for many reasons, but including the fact that they would receive a smartphone. And we mostly discussed ways to protect people's privacy. And so actually many of the project design elements about privacy and confidentiality were brainstormed in these sessions. I then conducted a pilot for 1 month with 12 people from a high-risk parole program in New Jersey to see if just this basic idea of using phones to study reentry was feasible. And the pilot was pretty successful overall. No one lost their phone over the 1 month period, and only one person of the 12 left the study early. And then we made some small modifications to the application, and finally the full study recruited 135 people, which were followed through phones for 3 months. And we also recruited a very small comparison group that we did interviews with every 2 weeks. And we recruited these people with the help of the New Jersey Parole Board. In the focus groups, I realized I need to create my own smartphone application as opposed to relying on one of the prepackaged applications available at the time. And these days, there's a lot of choices and options that researchers and practitioners have, actually. But at that time, there were more limited options. So the main reason I wanted to create my own application is because I wanted to collect behavioral measures such as limited information on call and text logs and also GPS locations, and I wanted to tie that information to survey prompts. So when someone enters or exits an area, you could theoretically then send them a text message or a survey. These functions were really not available with applications at the time, so I developed an application with undergrad students in computer science, and this is what the homepage looked like. So our smartphone app, Survey Droid, functioned in several different ways to collect data. We had a few different types of automated surveys, which automatically were sent to participants daily. And then participants could also start surveys on their phone after they had a job interview or received a job offer. We also passively collected information. So we collected GPS locations every 15 minutes between the hours of 8 a.m. and 6 p.m. and limited information on call and text logs. And I just want to point out that we encrypted these phone numbers of people's contacts. And that was really important because people's social contacts or phone contacts refer to information about individuals who did not agree to participate in the project. And so we used a relatively sophisticated way to encrypt those numbers, but encrypting them enabled us to help protect people's privacy while also being able to distinguish between old and new numbers. In terms of the project design, for each participant, we conducted an initial in-person interview. And I just want to echo the lessons learned from the previous speaker who really emphasized the importance of in-person enrollment and in-person contact. And that was really important here as well. And so at the initial interview, we set up people with the smartphones and with the survey applications and ran through a practice survey with them. Then we followed their experiences over 3 months, and at the end did an exit interview with each person. People were randomly assigned to either the smartphone group or the interview group. If they were in the smartphone group, they received phones, paid data plans, and they sent information through that Survey Droid application. Of those who were eligible, 89% of the smartphone individuals chose to participate. 68% of the interview individuals chose to participate. So we had a really high initial participation rate among the smartphone group, almost 90%. I think that this really high participation rate demonstrates one of the major strengths of using smartphones to collect data among this population. And then within the smartphone group, I also fielded an experimental intervention, which is this online job club, where half of the group was assigned to this online job club for job information and also for the opportunity to share social support with each other. And then the other half received the same job information from us, but through individual text messages. So each of these job clubs consisted of about 10 to 15 participants at any time and was headed by a researcher who sent daily job leads to the group. All the names in the group were anonymous, and we used the free application GroupMe in order to organize this part of the project. So the main aims of the job club were twofold. So first, to share information on jobs, not just from us, but from other participants who were looking for work, or more commonly who had already found work and were letting people know that there was openings at their job. The second aim was to provide peer-based social support. And we found that the job clubs served both of these purposes for participants. So people really encouraged others to apply for jobs, to attend job fairs. People posted on their successes at finding work and their disappointments at not getting a job. And other participants replied with either congratulations or with words of encouragement to keep on looking and to let them know it takes time to find a job at Reentry. One additional outcome of the online job club, which we didn't initially anticipate, was that it actually redirected people's focus and attention to this club and their job search, and it decreased the amount of time that they spent on their personal communications on the phone outside of the club. So as an example or illustration of this, this figure describes the effects of being assigned to the online job club on people's personal communications on the phone. So participants who were assigned to the club had smaller networks overall outside of the club. They spoke to each person on the phone for less time, and they spoke to each contact fewer times compared to those who were assigned to receive individual-based text messages. And this finding is really actually consistent with communications theory and research. That research finds that people have a threshold for their amount of communication. So by assigning people to this online job club, we were able to redirect some of the communication that would have normally occurred to job search and to finding employment. What effects did assignment to this club actually have on outcomes that we care about? Well, this next figure shows the effect of the club on participants' reports of happiness, sadness, stress, and anger. And you can see that people assigned to the club were happier, less sad, stressed, and angry compared to those not assigned to the club. but these differences were not statistically significant. Finally, this figure shows the effect of the club on the proportion of days people spent searching for work and working. So people assigned to the club spent more time searching for work and more days working, but these differences are fairly small and they're not statistically significant. So overall, I think that the direction of these results are promising, but given how small the number of people in each group was, so it was about 65 people, we need to do more work and larger studies to see if these differences remain in larger samples. So overall, I conclude that the smartphone design really resulted in a high participation rate and a relatively high retention rate over the 3 months. And in exit interviews, we found that the majority of participants said that they preferred smartphone surveys to in-person interviews because it was more convenient. And in some cases, they also said that they felt that there was less stress with smartphone surveys compared to being in an interview with a researcher. Smartphones can enable researchers to collect new and more comprehensive types of data, which are advantages that are really well suited to the study of contexts that are unstable and that frequently change. And so in this presentation, I described one type of intervention, this online job club, but there are lots of different possibilities, some of which have already been talked about here, to potentially try to change people's behaviors or redirect people's behaviors. At the same time, smartphones are relatively new tools. So smartphone surveys enable researchers to ask really frequent questions, but these are brief questions. So topics that require more in-depth or open-ended interview questions are not well suited to smartphone surveys. Missing data are also more common with these methods. And based on lessons learned in this project, I suggest that good smartphone designs take seriously a number of different issues that are specific to smartphones, like privacy and confidentiality issues, incorporate strategies to gain participants' trust, address the range and technology skills of participants, and also plan early for some of the logistics of whether you provide phones or not, whether you pay for phone plans or not, and what sort of applications you use to collect data and interact with people. And so while I don't have time to go into all of these things here, I actually talk about these points in greater detail in a recently published article that's cited on this slide in Sociological Methods and Research. So if you are interested in these other more concrete strategies, please look at that paper. So thanks very much.
Thank you. Thank you very much, Naomi. And we're also going to have a question period at the conclusion of this presentation, so you'll have a chance to ask all of the speakers for some follow-up. Next speaker is Ken Harris of the Healthy Start in New Haven, Connecticut, who's going to talk about their use of cell phones to engage fathers in actual programming. And Ken, we're delighted.
Me too. Can you hear me?
Yes.
Oh, perfect. Hello, Challenge. Sorry, I apologize. The use of cell phone, a mobile health texting service, has been a useful tool, a powerful tool in changing behavior in the public health interventions, including smoking, weight loss, and depression. And so we really wanted to look at how it would work with engaging men. And one of the attracting features of the mobile phone is this ability to use short message system, or SMS. And so SMS messaging costs less than a cell phone and can reach people even when their phone is turned off. And so thinking about this population, we thought it would be perfect to try it with this population. Next slide. So the goals today, I just want to share a few of the goals for today, really is to give you a brief description of the New Haven Healthy Start Daddy Delivery Texting Program and some insights into our program in New Haven, and then to share some very, very early learnings from the texting program, and then to talk about some of the findings from focus groups with fathers about receiving texts on their phones, and then really emphasizing, lifting up the practice of ensuring that this type of intervention is connected to a program and how that can strengthen the intervention. Next slide. And so this slide, you'll see really how our Healthy Start Fatherhood program works. And really, we want to connect dads before, during, after, and beyond pregnancy. And for us, men's health is critical to that. So the intervention is about connection and engagement. So as we target the partners of the women that are enrolled into the Healthy Start program and other men to come in and engage in men's health services, as well as providing services to support women throughout the pregnancy. And so that just gives you an idea of how the program is laid out. So these text messages really are given along this particular continuum of before, during, after, and beyond pregnancy. Next slide. And so the National Healthy Start Organization is a membership organization to 100 Healthy Start sites across the country, and all of these 100 sites have some level of fatherhood programming, and about 40% have full fatherhood programs, and they've been trained on the core adaptive model for fatherhood. And so we really targeted those programs that had full fatherhood programs in place, and New Haven is one of those. And so with the Texting for Dads, it's really about educating and keeping dads connected. And this was a partnership that we did with Mr. Dad, the Men's Health Network, and our national office to work together to develop this program. And we desired to establish what we call locked-in engagement, so how to connect dads and keep them connected. So in the United States, we know about 90% of adults own and use cell phones, and so that's, again, why we want to go down this route. And, again, that age group of 18 to 49 have a high rate and use of cell phones. Next slide. And so the framework for the Daddy Delivery Texting Program is this. Men, once they sign up to receive text, they will get 2 messages per week. And the messages are across a prenatal, postpartum, and early years, and they get these messages. They sign up for 3 years, and they can opt out at any point. But the messages are 2 messages per week, and the messages are really aligned with the stage of development of the infant. So the message content, he's getting messages around pregnancy, messages how to support mom, and then messages about the development of the baby, and then also a health message for him. And so this texting program was piloted with sites that had fatherhood programs, and then we also did focus groups with those sites. We want to ensure that this texting program was housed within the program to support the men and fathers with resources and referrals, follow up and follow through. And then we selected sites, as I said earlier, that had already received some of our technical assistance in how to support these men. Next slide. And the next slide, I just want to kind of give you a purview into how we target the African-American men, because the intervention was targeted for African-American males. And so at the top of the slide, you'll see an image of a man there. And the idea was through our outreach and recruitment, men came from, various forms of outreach and recruitment. Again, our idea is to connect him to the pregnancy and to a good birth outcome. And then to the middle left-hand side, you'll see a man that's connected with the partner. So with our Healthy Start woman who's enrolled, we got males connected to the program through her. So men came through 2 ways, one through the Healthy Start participant, and then men also came through just regular community outreach. And that's how they got to the fatherhood program. And once they signed up for the program, they were introduced to the texting service, and they would sign up for the texting service. And so that's how men got the texting and introduced through a fatherhood program. So fathers enrolled the program as they were introduced to Healthy Start. Next slide. And so with that, we had some early findings or results from that. So really to give you an idea of who enrolled. So we had about 51 low-income African-Americans enrolled, and all of them were over 18 years old, and some were first-time dads. and many had multiple children, and some with multiple partners. And so all of the fathers were assessed and served through our two fatherhood programs in New Haven, and also offered a support group called the Men's Consortium. 27 of the men also enrolled and graduated from our 24/7 Dads program, which is a 6-week education class for them. And then about 15 of the guys, 29%, enrolled in and graduated from another program we offer called Dads and Diamonds Are Forever, which is an 11-week program. Next slide. Some other results. What did they say in the focus groups that we did? Most of these men, these are all self-reports and youth surveys, most reported that they had an increase in knowledge about pregnancy. They learned about infant development, and they learned more about their own health.
So our last presentation is about a new and about to be launched, newly launching project funded by FRPN that deals with innovative strategies to engage and retain men in responsible fathering services, and we're testing the impact of cell phone technologies. Anna.
Thank you for having me as part of this webinar. I feel like the project that we are about to roll out really builds on the work of the other presenters that you've heard today, and we're really excited about this new initiative. A little bit of background. I work with the Suffolk County Fatherhood Initiative, which is a DHHS ACF Healthy Marriage Responsible Fatherhood funded program. We are in our second round of funding, so the program was funded for 4 years from 2011 to 2015, and during that time served over 800 low-income men in Suffolk County. Suffolk County is located about 50 miles outside of New York City. It's a large county with an economically diverse population spread out in urban, suburban, and rural areas. So we had a significant issue with retention in the program and in our evaluation protocol in the first round of the program. And we've recently been refunded for the next 5 years from 2015 to 2020. So we enrolled over 800 men in the program, but over 85% completed a baseline assessment, but at 12 weeks, we were only able to make contact with 36% of participants, and then that dropped down to 18% at 24 weeks. So that's kind of the background why we proposed this cell phone and texting initiative. So FRPN has funded this project for the next 2 years to explore the use of cell phone provision and text messaging specifically to increase program engagement, participation, and retention for fathers enrolled in the Suffolk County Fatherhood Initiative program. We noticed that many clients do have phones, and a lot of our participants are able to get what they call Obama phones, but they run into problems with maintaining minutes on those phones and being able to consistently use them over time. We also have a large segment of our participants who live in temporary residences, such as family shelters, substance abuse programs, halfway houses, sober houses, and so that's contributed a lot to our inability to connect with them at closing and at follow-up. So some of the goals of the current study to really look at how cell phone provision and text messaging specifically can impact engagement. Engagement in the program, participation, and retention. We're interested in retention in the program, but also retention in our evaluation protocol specifically. So we're looking to compare how text messaging affects these outcomes compared to a control group, which receives all fatherhood services and reminders and incentives for interviews, as well as compared to an increased incentive group that does not receive the texting intervention but does receive an increased monetary incentive. We also really want to figure out the feasibility of using this type of intervention for fatherhood programs specifically. In developing the protocol for this program, we've worked closely with former program participants, and we really want to see how this plays out on the ground and what the experiences are for dads and for program staff. So some of our outcome measures that we're looking at participation by basically counts and how many activities and how much contact they have with program staff. We are looking at another primary outcome is engagement, and we actually worked with a focus group of former participants and program staff to develop a measure of client engagement that's based on a measure developed by Yachmanoff in 2005 for work with mandated child welfare parents. So we modified that, and we're hoping to see how that measure works with dads and to see if we can start to get some measures of their actual engagement in the program. Retention, we are measuring by authorized activity, and then we'll also have measures of father involvement, healthy relationships, and economic stability as part of the larger Healthy Marriage, Responsible Fatherhood initiative. And so this breaks down the groups, the 3 groups. So we're using random assignment into 3 groups with 310 men over the next 18 months. All groups will receive services, incentives, and reminders as usual. And then our cell phone group will receive cell phones if needed, minutes if needed. So that's going to be the part of that intervention group that's going to vary. When we talk to participants, former participants and current participants in the program, we found that some of them shared that they would prefer to use their own cell phones and not have kind of an extra phone to deal with that was just specific to the program. So we will either provide cell phones if needed, provide minutes if needed, and then the main intervention will be the text messaging twice a week for the course of 12 weeks, as well as reminder phone calls for the evaluation data collection points. And the third group will receive the increased incentive, which will be $25 at each time point tied specifically to program participation that both the participants and the staff will be tracking. So we're using an online program called Easy Text to send text messages. And unlike some of the other presenters today, we are not going to be using text messaging to collect any information from clients, but they will only be outcoming text messages. We do have the capacity in the program to reply to text messages, so if a specific question is asked, we will be able to reply to them, but we're not trying to gather any information. We're just having outgoing informational. So these are just some samples of some of the text messages broken down by week. We have some of them are reminders about our evaluation protocol and our data collection, and some of them, for example, in week 5, remember to do your part in creating a safe space, don't feed into negativity. Those are phrases and reminders that are taken directly from the fatherhood intervention that they'll be receiving. So they can either enroll in a father involvement group or a healthy relationship group, and that language is coming directly out of the intervention. So it's kind of reinforcing the intervention at the same time. And then the other text messages are reminders about program services, reminders to call their case managers, and then again, reminders about the upcoming assessment. We are going to start implementation and random assignment this coming week. So our next steps are to get the random assignment going. If we need to refine the content of the text messages, we're open to feedback on that and seeing how these text messages work, the ones that we have developed together with program participants. We are going to incorporate some questions specifically for those assigned to the cell phone group at the end of 12 weeks of services. And we also have a qualitative component at the end where we'll be doing some focus groups and some more open-ended interviews with both program participants and program staff to find out their perceptions and their feedback on this program. So that is, I have my email here if you have any questions, and I'm turning it, I think, back over to Jessica.
Great. Thank you very much, Anna. Okay, this is your time, guys, audience, so please press *1 and tell the operator you have a question. You can direct it to a specific participant, and if you want to contact us at FRPN, here's our information, and the website for FRPN is www.frpn.org. Do we have a question, or should I kick it off?
You should kick it off, Jessica.
Okay, so I guess I want to ask our panelists, what's on the horizon? What do you think are the most pressing questions for practice, for program use, vis-a-vis cell phones, and then also some research questions. I mean, what's the next step? We've heard what Anna's going to be doing with her work. I guess Lindsey and Naomi, from where you've worked in this field a little longer, what do you think the next horizons are? Lindsey?
Sure. Well, in terms of our program, we've actually been expanding the program. We started out with just 6 or 7 schools in Maryland, and we're actually up to about 22 or 23 right now. Mm-hmm. So we'd like to continue expanding. We've also recently, this is going into the second year right now, we expanded this program and sort of adapted it for use with parents of preschool-age children. So we're working on that. I think it's something that can be implemented really across the board, so finding ways to use it in different and novel ways to reach hard-to-reach audiences.
Okay. And Naomi, what are, from your point of view, what are the next horizons? Naomi?
Naomi, are you on mute?
Oh, hi. Sorry, I was on mute. On my end, sorry. So I was just saying, there's 2 levels here. So from my personal perspective, for my own work, I'm very interested in using smartphones to facilitate peer interactions, as I discussed in my presentation. So how can we leverage this technology to try to connect people with their peers in a positive way, in a positive structure? But I think for the field more generally, I think that we need to do more work on actually testing how the format of questions, how the format of information sharing is actually effective or not effective. And I really liked Anna's presentation because I think that's a very rigorous model of testing whether using text messages does improve engagement and retention. And I think we need more studies like that. They're in some ways testing these different aspects of using smartphones or not using smartphones and using text messages can be a little drier than collecting the information and analyzing the actual data. But I think that it's really, really important work, and I hope foundations and funders see that that is important work.
Okay. Do we have a question at this point?
Yes, ma'am. And our first question comes from Matt Au from MDRC. You may now state your question.
Hi, everyone. I know the first presentation mentioned using short codes. I'm not sure if the rest of the research studies utilize that. But specifically about that, can you describe what sort of barriers you encountered because of using short codes? And more specifically, do you happen to know if government-issued phones by default might filter those out?
So in our work, I think it was really just a barrier to being able to enroll in the program. So a lot of our low-income, low-literacy populations just didn't know how to send a message to someone that wasn't in their contact book in the phone. So I think a lot of that was just, like, how do I send a message to, like, a 5- or 6-digit number instead of a contact? And as for the question about the government-issued phones, I'm not really sure that I could speak to that. I'm sorry.
No problem. Thank you.
Does anybody else have experience with government-issued phones? I think maybe, Ken, you mentioned Obama phones.
Yeah, that's in another program, and this one we didn't. No one had government-issued phones. They're all personal cell phones. Again, because we were using the text messaging, standard messaging, which they work when the phones aren't even shut off, and that's why we chose that route.
Okay. Okay. Do we have another question in the queue?
Yes, ma'am. And our next question comes from Anna Kolner from SGA Youth and Family. You may now state your question.
Great, thank you. My question has to do, I think it's probably best if I pose it to whomever might feel like it's most appropriate for theirs, is thinking about kind of variability within the population of folks that you tested this with. Thinking about some of your comments suggest to me there may be differences among different aged fathers, and perhaps in terms of, for those of you that collected data, if you have a sense or a hunch about if there were any particular types of data or activities that were more or less not just easy to collect, but that participants were more or less likely to want to tell you over text message, if that makes sense. So I guess that's a really two-part question about the different ages of fathers and if they are more or less kind of adept at doing some of this texting, and then what kinds of information are easiest to receive over text message. Does that make sense?
This is Naomi. I can speak to the various technology skills of participants very briefly. So in my group, people ranged from early 20s to late 60s. And they were also all recently released from prison. So some of the older folks in particular had been incarcerated for a long period of time. So we did really encounter some difficult technological challenges among some participants. We tried to address this in a variety of ways. First, we just simply asked people how comfortable they felt with using cell phones and smartphones, and that question ended up not being very helpful. People often said that they were very comfortable even if they had never owned a smartphone in the past.
So ask people if they have a library card. Everybody has one, except they don't, right?
Yes. So what actually ended up being more helpful is that in the initial interview, we had everyone do a practice sample survey, and we walked through it with them. And walking through the sample survey with them provided immediate feedback about whether they did actually feel comfortable using the touch screen on the phone and doing things that were beyond text messaging and making phone calls, because I think people are pretty comfortable doing text messaging and making phone calls overall. But of course there is still some variability within that. We also offered an optional training session provided by Verizon that went through the basics of turning on the phone, of how to use the phone, how to place a call, how to do a text message. One of the issues that we encountered that was the most difficult to address was actually that people were trying to force the charger into their phone in the improper way, and so they would actually break the charging device on their phone.
Oh my gosh.
So going through things like that may seem kind of obvious, but going through things like that in the optional training session was very, very helpful.
Thank you. Anyone want to add anything to that?
Yeah, I would just add a little, and we found some of the same things, but something interesting we also found among our population, and many of whom had been recently incarcerated, was that the smartphone that they had was actually purchased by someone else. And so very sophisticated phones are among our population, but many of them someone else had purchased it for them, because that seems to happen a lot with our men who come out of prison. Someone else is kind of supporting them a little bit.
Okay.
So just to keep that in mind.
Okay. Jay, did you want to, Jay Fagan, do you want to ask a question or make a comment? Okay.
We do have our next question from Barry McIntosh.
Okay, let's go there.
You may now state your question.
Yes. I wondered if anyone can address the issue of other technologies rather than just texting. We found that even a lot of our guys are apprehensive with texting, or just have moved from texting to Facebook messaging, and other ways of communication. Is anyone looking at the newer technologies as things change?
Anyone?
I can answer that, because the reason I'm here at Boston University is I'm working with a group, Dr. Brian Jack, who developed an avatar for preconception with African American women, and so we're working on developing one with men called Gabe. So, and we've done several focus groups in Connecticut, Rhode Island, and Massachusetts. So just some early learnings from that. But the focus group, men actually love engaging with that type of technology. So moving into that kind of virtual platform. So that's what we're exploring as well.
Okay, next up.
And we seem to have no further questions at this time.
Well, I want to, I guess I want to go back a little bit to the question or the issue of we maybe return. It seems as though we've focused a lot on engagement and retention, but in terms of other types of outcomes from the use of cell phone technology. I mean, Naomi, you alluded to the fact that you didn't see any higher job acquisition and participation from online job clubs, I guess. But on the other hand, Lindsey, you did see better dietary habits among those who were in the cell phone group. Do we have some ideas about what kinds of behaviors and outcomes are amenable to manipulation potentially through the new technology, and what are more immutable and require other types of interventions? Anyone want to respond to that?
Yeah, for me, with the men that were using their cell phones, as I said, one of the groups that they participated in was called Dads and Diamonds, which was this 11-week group. And all of those men were aware that each of them were enrolled in getting text messages, so this camaraderie kind of grew. And so I know that they were always sharing resources, and we did have a couple of men that got jobs, following up on connections they were making at these weekly sessions. And so that was something unexpected, but this camaraderie kind of developed, and they began depending on each other for information about what's going on in the community. And many of them followed through, and as I said, by the end of that 11 weeks, some men had actually acquired jobs and were volunteering. Different things were happening, I think, just because they were meeting regularly. So
okay.
Yeah.
Naomi?
Yeah, so I think that interventions may be most effective if they're trying to change behaviors that are within the control of the participant, right? So in terms of finding employment, there are so many barriers for men who are reentering from prison. One thing that we are going to try to do in the future is really take seriously the type of information about jobs that we're sending people, because we try to find felon-friendly employers, but it's a structural issue that is just so difficult. So I think that the more promising aspect of the online job club was really kind of what Ken said, was developing a support system that people did say that they were feeling better about their jobs or happier about their job search than people who are not in this peer-based group. And some of the texts that people would send to each other were just incredibly positive and heartwarming, and it became a place where people would not only talk about their job search, but also talk about other issues that they were encountering, such as having to go to court and feeling really nervous about that. There was a lot of vulnerabilities that people did expose through this anonymous group forum. So I think that there's a lot of potential in terms of the peer support idea.
A community building.
Yeah.
What about in the nutritional area? Are there some behaviors or some kinds of things that were kind of lower hanging fruit and others that were then more mutable and harder to manipulate?
Well, we have found better outcomes with fruit and vegetable consumption and parental role modeling of healthy eating behaviors, as well as physical activity behaviors. Our survey is pretty concrete and time-specific, so I think it's possibly easier to measure outcomes with that. But also, the purpose of this text message program was to complement the nutrition education that the youth were receiving in school. So we were really targeting it more as a family unit. So I think targeting multiple layers sort of helped to enable us to see better outcomes.
Do we have any other questions that have materialized?
Yes,
anything in the queue?
Yes, ma'am. And
okay.
Our next question comes from Wayne Thornley. You may now state your question.
Thank you. I'm going to go back to the retention and recruitment issue. We operate a statewide network of fatherhood programs here in South Carolina. And so I'm going to sort of target my question to Anna because what we're considering would be very similar to what she has described, in that we wouldn't be doing so much a research project, but just trying to increase retention in our programs. My question is really more about logistics of implementing something like this.
Okay.
Man hours that it takes to actually have someone, keep up with this and do it on a regular basis. And then a follow-up to that is she mentioned the Easy Text program. I'm wondering, does that platform allow for the sharing of these text messages so that guys can invite other participants who may be interested or need the types of services that we provide?
Okay. Let me start by saying, as far as the man hours, I have my newly hired research assistant here with me. So man hours is something we've been talking about, and I think it's one of the unknowns in this program that we are going to find out, and that's kind of a feasibility issue. How much time and effort is this undertaking? And is it reasonable to be able to incorporate it into an actual program? Now, we have outside funding and outside resources, so I'm able to hire somebody who is pretty much dedicated to sending out these text messages, keeping track of everything, dealing with any technological problems that come up. But we really do want to see what the burden is and how we could incorporate it into a program if we wanted to do so. As far as the Easy Texting program, it's an online program, and it allows you, one of the benefits of it is that it allows you to send group messages, but they would go through individually. So we could send the same message to everybody who just came in the program during week 1. Or you could send individualized messages. Now, could they share those messages with other people? I believe they would just be able to forward the text message like in a regular, like a normal text message that you received from somebody else. There shouldn't be any restrictions in doing that. It would depend on the capability of their phone. I'm not sure if that answers the question. I think it could potentially be used maybe for recruiting. We haven't proposed to use it for recruiting, but I think that's more along the lines of what you're asking.
Right, yes.
Okay. I think we have maybe a minute or two to spare. I'm going to take that opportunity to, again, encourage you to respond to a follow-up email about a survey for future topics, webinar topics. I want to thank our panelists, Lindsey, Naomi, Ken, and Anna, and apologize for tech difficulties we encountered during this webinar, and encourage you to sign up for FRPN so you get the online newsletter and other announcements of opportunities and resources through FRPN, and look forward to inviting you to return to our next webinar, which will be, they're scheduled quarterly, so we'll be back in touch. So thank you to all, and have a great rest of the day.